and the hard palate is referred to as the inferior meatus. Okay. The area between the middle concha and the inferior concha is called the middle meatus, and the area between the superior concha and the middle concha is the superior meatus. And this area back here between the ethmoid and the front of the sphenoid bone is referred to as the sphenoethmoid recess. So we'll talk about how openings of various sinuses, how they open into the nasal cavity, but they open in very different places. Okay. Again, when we did skulls, we talked about these air spaces, these sinuses, sort of just areas in the skull that are not solid bone, but they're just great big air-filled places. And as I said, they all open into the nasal cavity. So there's all of these things are paired. If there's a left one, there's a right one. Okay. So there's right and left maxillary sinuses. Rather obviously, they're in the maxilla. There's right and left ethmoid sinuses, which are in the ethmoid, although these are lots of little individual things. There's right and left frontal sinuses, which you've seen when we saw it off the top of the skull. They're little air cells in the frontal bone. And then there's right and left sphenoid sinuses. So that big sphenoid sinus that you see under the sella turcica, you always see it in cross-section, but in fact it's got a partition in the middle of it, so it has right and left parts. Here they are shown in outline on a person. So here are these air spaces in the front of the frontal bone. Here are these great big empty spaces in the middle of the maxilla. The ethmoid air cells are sitting here just adjacent to the midline, right, just below the orbits. In many cases, when you guys were chipping away the top of the orbit, you opened up these ethmoid air sinuses. You saw these little things that look like small balloons down in there. And then you can't see the sphenoid sinus because it's directly behind here. So there it is in side view. So it would be about right there. And just show you again where the maxillary sinuses are. Okay, and here they are in their location within the face and the skull. There's your sphenoid sinus just below the sella turcica. Okay, there's the frontal sinus, these empty spaces in the frontal bone just above the brow ridges. Maxillary sinus, so this whole maxilla, which extends out here, is hollow underneath. And then if you cut through the ethmoid bone, you see lots of little individual air cells. So those are the ethmoid. That's collectively the ethmoid sinus. And you see the sphenoid in all these views. And yet again, here's a coronal section. So we've sliced down, sliced through the orbit. There's the eyeball. There's the orbit. And then medial on either side between the orbit and the midline, like I say, are these ethmoid air cells, which, like I say, when you chopped over the top of the orbit here, many of you exposed these. And then the frontal sinuses, which are in the frontal bone. When you buzzed off the top of the skulls, you often see those exposed. Nasal cavity here, there, conchae, that you can see. There's the big maxillary sinus to the lateral side of the nasal cavity. And the sphenoid sinus is going to be behind here. Another view, this is a horizontal section. Okay, so then there's eyeballs, just lateral. You have all these ethmoid sinuses. Directly behind them, you have the right and left sphenoid sinuses. So the maxillary sinuses are going to be further back into the blackboard. The frontal sinus is going to be further out in here. It would lie up there. Okay, this is sort of cool. When you're born, you don't have these big empty spaces. You have a much tiny little head. You see the little baby skull that we had in the lab. But as the skull grows, the size of these sinuses increases. Okay, so when you're born, Down here, you have a little bitty maxillary sinus there. And as you get older and older and older and older, the maxillary sinus increases. And for dentists, this can be a problem. We talked about this earlier. The maxillary sinus can even invade the area where the roots of the upper teeth lie. So you can have a sinus down here, in the infection in the bottom of the maxillary sinus that can get into your molar teeth. But these things, as people grow, these things change shape and change size throughout ontogeny. Okay, back to our friends on the inside of the nasal cavity, trying to pull these two things together. So we have all these paranasal sinuses, called paranasal because they are adjacent to the nasal cavity in some way or the other. And they empty into the nasal cavity. Okay, so what we've done here is we've cut away this middle concha here. Okay, and if you cut away this concha that would be lying in here, there's the superior meatus, middle meatus, inferior meatus. Deep to that, behind that concha, lateral to that concha, is an area with lots and lots of morphology. There's this sort of bulging area here. Okay, looks like a small clamshell or something, which is called the ethmoid bulla. Okay, because this is all ethmoid in here. Okay, the area, there's sort of a groove in front of it, deep groove, known as the upper part's known as the infundibulum. Okay, there's a hole in here, just below the bulla, known as the hiatus semilunaris. And this thing that sort of is anterior to them, this sort of sickle-like thing is called the uncinate process, but it's obviously faded out. Okay, so how do different sinuses drain into the nasal region? Okay, this is your frontal sinus. There's a tube going down into here known as the frontonasal duct, and so mucus or secretions or infections or just air in general from the frontal sinus can get into the nasal region through this infundibulum, this groove, this opening in front of the ethmoid bulla. And people giving anatomy exams have been known to, stick a pipe cleaner up there, or stick a popsicle stick up there, and say what empties into the nasal cavity through this opening. Okay, the ethmoid air, as you saw, those of you who busted off the top of the ethmoid when you're trying to get into the top of the orbit, you saw that there wasn't just a big opening, but there were lots of little bubble things. Each one of them, about the size of an M&M or something, that looked like a whole series of little baby balloons. Each one of those is an ethmoid air cell, and all those little individual air cells in the ethmoid sinus dump into the nasal cavity in different places. Okay, so the anterior ones, the ones closer to the front, can open into the frontonasal duct up here or into this infundibulum area. The middle ones, the ones that are back up in here, open into the nasal cavity through a little opening in the ethmoid bulla or slightly above it. And the posterior little sinuses, which are back up in here, open into the superior meatus, between the lost concha here and this, or back in the sphenoethmoid recess. So not surprisingly, the individual cells up here dump anteriorly, the middle cells dump in the middle, and the more posterior individual cells dump in more posteriorly. Okay, so here we are again. Okay, so just as I suspected. Here are some wires that have been put in connecting the the frontal sinus into the infundibulum, showing that is in the frontonasal duct. Okay. Here are the edge of the, well, here's the semilunar hiatus, and there's where that wire is coming in. Back here, the sphenoid sinus drains into the sphenoethmoid recess, which somehow got disappeared from the slide. Obviously, these middle ethmoid cells are going through there. The posterior ethmoid cells are going back there. Down here, in the inferior meatus, is where the nasolacrimal duct empties. So tears from the orbit, as we mentioned earlier, end up in the inferior meatus, and that's why when you cry you have to blow your nose. Okay, this opening here, okay, this big gap here is where the maxillary sinus drains. And it's not uncommon for when people open up their cadavers and get rid of the nasal septum, you find this opening is enormous because some doctor has gone in and stripped out the inside of the maxillary sinus because the person has persistent sinus infections. Okay, so you need to know, where these individual sinuses drain. And you will be able to, you'll certainly be able to see the overall morphology, and you can, if you want, you can stick broom straw or whatever through those, although there's also obviously tissue there. Okay. This picture is sort of screwy looking. What has happened is obviously the right and left nasal septum, the right and left nasal cavities are separated by the nasal septum. So in this case, the midline has been flipped up, right? So you're looking at the lateral nasal wall on the right side and the wall of the right nasal cavity flipped up. So this, if this were flipped down, the right nasal cavity would be, you wouldn't be able to see it because all you could see was the nasal septum. Arteries of the nasal. The big artery is this sphenopalatine artery, which came out of the infratemporal fossa way back there. It's one of the last gasps of the maxillary artery. Comes through the sphenopalatine foramen and provides blood that goes to the lateral nasal wall as well as the lateral side of the nasal septum. So this big artery comes in here, sends littler arteries all over this area. Okay. Just to remind you, remember when we dug into the infratemporal fossa, there was this maxillary artery corkscrewing its way through there with little branches going in various directions, some of which you could easily find, like the inferior alveolar, some of which were more difficult. Middle meningeal was always a real popular one. Deep temporal arteries are always really popular. And then as you get towards the anterior part, it's hard to see back in there, but there's the infraorbital artery hitting under the orbit and onto the face. This posterior superior alveolar artery, which is going into the back of the maxilla to supply the upper teeth. And then way back up here is that sphenopalatine going through the pterygopalatine fossa and giving rise to those arteries that we just saw. Here it is in much more detail. Okay, so here's the sphenopalatine coming in here, and it gives rise to a posterior ethmoid artery up there, a septal branch. So this branch is going to spread out through the nasal septum, which has been flipped up here. These branches on the side are lateral branches. So this one's heading to the septum, this one's heading laterally, spreading out over all these conchae. Okay, and then it actually ends up, these sort of come together and end up, and then there's also the superior labial artery, which you might have seen on the exam. Okay, so most of the interior of the nasal region basically is all this sphenopalatine artery that comes through the sphenopalatine foramen. So when you get punched in the nose and you get a nosebleed, that's the culprit. Just to remind you, here's this diagram of the sphenopalatine fossa. Okay, and where are we here? Da, 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 da. Okay, so posteriorly, right, so here's the posterior area back there. Medially is the nasal cavity. Down is something we'll see a little bit later, something called the palatine canal. You go upwards, you end up in the inferior orbital fissure. And then there's not much going forward because you've got a maxilla here. Okay? So this goes posteriorly, going toward up high, you're going towards the middle cranial fossa. Down below, you've got the pterygoid canal. Realize the pterygopalatine fossa is a space, right? It's a space in there that various things pass through on their way to the maxilla, on their way to the maxilla in front, up into the orbit, or down into the palate area. Again, more of these branches of the maxillary, but the point is, the one that we saw a few minutes ago going into the nose is the sphenopalatine, but there's another branch here, which is the descending palatine, which is hitting more inferiorly. Okay. So here are the nasal branches that we talked about. Okay. And here are these palatine branches that are hitting down here. Okay, which end up on the upper part of the maxilla, the lower part of the hard palate, and the lesser palatine branch coming down there. Okay, so it's the same view. So branches coming out of here, most are going forward to do the inside of the nose. There's also branches that are coming down to do the palate. And we're going to, later we'll dig into the area lateral to the nasal cavity and find these structures in the pterygopalatine fossa. Okay, nerves of the nasal cavity. Okay, again, the septum has been